or you, any moment in your life, you may be feeling low, or what happened is that you may feel like you are having the mental illness. So, who thought that it is essential that we have to formulate the mental health policy? Furthermore, WHO, it says that by the year 2020, the one of the most common mental disorder, that is depression. This one will be the
Excuse me, ma'am.
yeah.
Sorry to interrupt you. मैम आपकी स्लाइड शिफ्ट नहीं हो रहा है.
But यहाँ पे तो it is going.
Ma'am, it's not shifting.
It's not shifting. Your net is low.
Just our net is okay, ma'am. Actually, it's just showing the first slide only. World Mental Health Day 2023.
I think your internet connection is low, maybe.
Might be, ma'am.
Yeah, यहाँ से तो it is going only. Shall I share again?
Try, ma'am, please.
Okay, just wait, okay.
Yes, ma'am. Now it's visible.
No, now I have stopped sharing.
Yes.
Okay, where it is showing?
That comprehensive is a bit like the rest. Can you please start again?
8 minutes. Just wait, okay? It is not showing here now.
Students, please fill the front seats.
Can you see now, Soumya?
Fill the front seats first, please.
Yes, ma'am.
Which eight?
One is mental health and basic human rights for all people. That.
Okay. Why?
Yeah, now it's changing, ma'am.
Okay. Why do we need it now?
Yeah. Yes. Yes. Please proceed. Thank you.
Okay. So now the biggest question is why we need the mental health policy. Okay. So what happened is that nowadays mental health issues, it is becoming a big problem, and people are also becoming aware of the mental health issues. And one of the reason is that WHO, World Health Organization, says that 10% of the global population in any moment of their life, they were affected with the mental illness. Maybe I may be affected, or it may be you. And what is said is like a moment comes in our life, okay, where we will be feeling that we are low, or we feel that we are mentally ill. So what it suggests here is that the severity of the mental illness is increasing, plus the incidence of the mental illness is also increasing. So who thought that mental health policies, it is essential? And that's why who suggested, and that's why who also suggested that by the year 2020, one of the most common mental disorder, that is depression. This one will be the second leading cause of the disability in the. Okay. The next, why we need the mental health policy is that nowadays I think everybody knows the suicide is also increasing, And mental health illness, they are a key predicator for the increase in the suicide. And in case if the mental illness are left untreated, then it will be resulting in the stigma. Like for example, if we are having stress, okay, we may be visiting the psychiatrist or the therapist, but we are never mentioning to anybody that we are visiting a therapist because we are of the fear that we will be discriminated, plus we will be stigmatized. And this one is worsening the quality of the life of the individual. So because of all these things, the government of India, they constituted a policy that is in the year April 2011. And this policy, they have led a discussion like what is the need of the or issue regarding the mental illness. So whatever the recommendation they have taken, they have included that and they have formulated the mental health policy. And the document of the mental health policy that was passed in the October 2014, it is known as the New Parties, New Hope. So here what happened is that government believes that mental health, it is an integral part of all the health sector. So that's why they told the mental health one holistic approach should be there. And this holistic approach, it should recognize the linkage between the body, mind, and the soul. So coming under that, we will see the global mental health landscape. Okay, so under the global mental health scape, we have the prevalence of the mental health issues. So mental health issues, it is a global concern, and mental health is illness is affecting the people of all the ages, background, and the walk of the life. And mental health prevalence is also an issue worldwide. And this mental health issues, it varies by the reason, age, and the specific condition. So here we will see one of some of the key points what we have to consider. The first one is the global prevalence. So global prevalence means mental illness. It is affecting all over the world. Okay. So mental health issues like anxiety is there, depression is there, or even substance use disorder is there. And these all disorders, they are highly prevalent worldwide. And according to WHO, depression is the leading cause of the disability globally. The second issue is regional disparity. So here it says that prevalence of mental health issues, it varies significantly by region. Okay. So some factors are there like socioeconomic condition, access to the healthcare, cultural stigma, and traumatic life events. And all these events, okay, or all these factors, they influence the rate of the mental health condition. The next one is the age and the gender. So even the prevalence of the certain mental health conditions, they also differ by the age and the gender. So for example, I think all are aware that in case of the young adult and the adolescents, okay, they may be vulnerable to conditions like anxiety or the eating disorder, while the mood disorders, okay, like depression, this may be affecting individual of all the ages. Not only the age, gender also plays an important role in the mental health conditions like in case of the women, okay, disorders like eating disorders is common, and disorder like the substance use disorder, they are more prevalent in case of the males. Coming next is the impact of the event. Okay. So impact of the event, some events are there which may be leading to the mental health issues like natural calamities, we have conflict is there, public health crisis is there. All this, okay, they can lead to the mental health issues. And this event, they will be leading to an increase in the PTSD, that is the post-traumatic stress disorder. The next issue is the stigma and the underreporting. So stigma, already I have told you, mental illness, the stigma is attached. Okay, so because of that particular stigma, okay, the people who are affected with the mental illness, they will not be reporting also, and it will be gone under diagnosed. So many people, what they do is they will not be seeking help because they are having the fear. They once they have come out, they have told about their problems regarding their mental health, and they will be stigmatized in the community or in the society. So because of that stigma and the under-reporting, it is one of the mental health issues. Rising the concern, mental health concern has been on the rise in the recent year, and this is because of the stressors. Okay, now we all are living in the modern society, modern life, where the stress is very common. Okay, so what a rising concern is that maybe because of the stressor, our mental health issues are occurring, and this include the digital age, the work-related stress, and the social isolation. So here, based on all the prevalence of mental health issues, it says that these issues, it is not limited to a specific geographic region or even to a demographic. And addressing such a concern, it should be on a global scale, and it requires a comprehensive mental health policies. And here we have to improve the access to the mental health care so that we can reduce the stigma. Plus, we can increase the awareness about the mental health. The next one is the comprehensive mental health policies. So under there, they have given some points. What all we will be seeing. The first under the policy is the access to the care. So access to the care means regardless of whoever the individual, they should be getting the equitable access to the mental health services. We should not be discriminating. We should not be seeing their social economic status, their location, or the demographic. But whatever the mental health services, it should be provided to all the individuals. The next one is prevention and the education. So, in order to promote the mental health, we have to give awareness regarding the mental health. Plus, with the education, the stigma can be reduced, and we will be educating the public about the mental health well-being also. The next one is the early intervention. I hope everybody knows about the early intervention. So early intervention, what is that? Early, we will be detecting the mental disorder. Plus, we will be providing the intervention so that we can prevent the escalation, the severity, the increasing severity of the mental health issues. The next one is the work support. So here we have to encourage the mental health support in the workplace. So in order to reduce the mental health issues in the workplace, what all we can do? We can give the stress management therapy. We can give the counseling in the workplace. Plus, we can be giving reasonable accommodations. The next one is the integrated healthcare. So in case of the integrated healthcare, there should be an integration between the mental health and the primary care services. That is for a holistic approach to the healthcare. The next one is research and the data collection. Research should be done in the mental health, and data, whatever we are collecting, it should be to inform the evidence-based policies. The next one is the mental health policy. So here we have to ensure that the insurance coverage for the mental health policy is on the par with the coverage for the physical health. The next one is the crisis response. So under the crisis response, in case if any crisis has occurred, what we can do is that we can establish the crisis hotlines will be there, and wherever the mental health emergencies is there, okay, immediate response we can give to the people. So because of that, a team will be there which will be giving the immediate support to the people who are facing the mental health emergencies. Children and the adolescents. So whatever I have told from the beginning, like the mental health care, it should be also focusing on the children and the adolescents. Like special focus, we will be giving on the mental health needs of the young people. So here, not only support services, but school involvement services can also be provided to the children and the adolescents. The next one is the inclusivity and the cultural sensitivity. Here we have to recognize what are the diverse culture, what are the social factors, and accordingly we will be tailoring or we will be providing the services. Rehabilitation and the recovery. Rehabilitation and the recovery. So rehabilitation, that is coming back to the near normal. So here we will be providing what all available resources is there for the individual so that they can recover, and after recovering they will be able to live a fulfilling life. Next is the legislation and the legal framework. So here we have to develop the laws and the regulations, and this laws and the regulation, it should be protecting the rights and the privacy of the individual. Which individual? That is the one who are having the mental health issues or the mental health conditions. Peer support is also there. So here, encourage peer support network for the individual to connect and help each other through their mental health journey. Next one is homelessness and the mental health. Addressing the unique mental health needs of the homeless population and providing the housing solution. So whatever the needs of the people who are homeless. We have to address that one also. And as a solution, we will be providing them the housing solution. The next one is the telehealth and the technology. So here leveraging technology for the remote mental health services, and especially this one technology, it should be especially in the unserved areas, like in the remote areas. Training and the workforce development. Here we should ensure who all are the mental health personnel, they are skilled, so that whatever demand is there, okay, they will be able to meet all their demands. Crisis management plan. Here we will be establishing the crisis management plan, that is at the local level, regional level, and the national level. That is whenever any crisis occurs about the mental health, immediate care we will be able to provide. Next, we'll see National Mental Health Policy. What is the vision for the National Mental Health Policy? The first vision of the National Mental Health Policy is to promote the mental health. We have to prevent the mental illness. We have to support the recovery, whatever stigmatization is there. We have to destigmatize the mental health conditions and facilitate the socio-economic inclusion of individuals which is affected by the mental illness. So these are all the vision of the National Mental Health Policy. And in order to achieve these all policies, okay, the National Mental Health Policy, they ensure the accessible, affordable, or high quality mental and the social care services is available to all the people. So by making sure that all these are available to all the people, then only we will be able to achieve whatever is the vision of the National Mental Health Policy. Next comes the values and the principles. So here we will see what are the values and the principles of the National Mental Health Policy. The first one is the equity. I think previous slide also it is there, equity. Equity means that whatever the mental health services is there, it should be made available to all the people. Then the next is that budgetary allocation should be there. That is, adequate budgetary allocation should be there so that whatever the burden of the mental health problem is there, we will be able to deal with it in a fair and the equitable manner. Then equity, it also means that people with the mental health issues, they should have the equal opportunity, and this opportunity is regarding the education, employment, housing, social welfare, promoting inclusivity and the social integrity. The next one is the justice. Under the justice, the national mental health policy ensure that mental health services, whatever they are providing, it is accessible to all the people. So, especially those who may face the social, economic, or other form of the exclusion. So, especially to these people, they will be focusing if they also are getting the mental health services or not. The next one is the integrated care. So, for the effective delivery of the mental health services, whatever the existing healthcare system is there, it should be under a primary care approach. A primary care approach should be there, that is within the healthcare system. And we all know that some mental illness, they are chronic, and whoever suffering from the mental illness, some of them requires the long-term support throughout their life. That's why a primary healthcare approach should be there within the existing healthcare system. Evidence-based care. In the context of the mental health services, decision making should be informed by evidence based intervention. So, what it means is that whatever the services we are providing should be guided by a range of the evidence. So, how we will come to know about the evidence base is that through the research findings will be there, or practice based evidence will be there, or from the feedback from the clients. The next one is the quality. Whatever the mental health care services that is accessible to the people, it should not only meet international quality standard, but what it should be is that it should be culturally sensitive, and it should be acceptable to all the local users and the caregiver. Next comes the National Mental Health Policy, the goals of the National Mental Health Policies. The first primary objective is to mitigate the long term impact of the mental health issues. That is, the whatever the issues, like I have mentioned before, which is caused by the mental health. Mental illness, okay, they will the first objective is that they have to remove it. Secondly, the goal is to enhance awareness of mental health concern throughout the nation. That is, maybe it can be through the health education throughout the nation. We will be making the people aware about the mental. Another key aim is to bolster mental health leadership at the national, state, district level, thereby thereby foster, sorry, thereby fostering the effective governance and implementation of the National Mental Health Initiative. Next comes the objectives. The first objective is that ensure universal access to mental health care services. So same thing what I have repeated, we have to see everybody that mental health services or the care it is available to all the people, that is equitable distribution should be there. Enhance access to and utilization of comprehensive mental health services for the individual with the mental illness. The next one is we have to improve the access to the mental health care. And when we are improving the access to the mental health care, we will be giving more emphasis on the vulnerable groups. Okay, so here the vulnerable groups are those homeless people, those people who are living in the remote areas. Okay, and those disadvantaged people, that people who are considered in the disadvantaged background. So whenever we are providing the mental health care, we have to focus on this. The next one is mitigate the prevalence and the impact of the risk factors for the mental health problems. Next, reduce the risk, occurrence, and the rate of the suicide attempt. These are all the objectives. The next come national mental health policy values and the principle. So what are the values and the principle? The first one is that it should protect the rights and safety of the individuals with mental health issues. We should fight the stigma which is related to the mental health problems. We should strengthen the availability and equitable distribution of the skilled mental health professionals. We should increase the financial allocation and the support for the mental health. So some cross-cutting issues are there, and these are the issues regarding the mental health which needs to be addressed. So the first main issue that is the stigma. Okay. So one of the major challenges in the mental health is the stigma associated with the mental illness. Like I have already told before, if we are having any disease and all, we will be approaching the physicians. But in case if we are having any mental health problems or stress and all, for the fear that we will be stigmatized, we will be not coming out in the open. So what we have to do is that we have to make an effort, okay, to raise the awareness, educate the public, and promote the understanding to fight this stigma. The second issues in the mental health is that right-based approach. So, right based approach is emphasizing the individuals with the mental health problem and should have their right respected and be protected. And this includes access to the appropriate care, support, inclusion in the society without any discrimination. So, right based approach, okay, it is an approach where the people with the mental illness they also having their own rights, and whatever their right is there we should be respecting them and their rights should be protected. And as I have told before, whatever the mental health services or the care we are providing, we should be making it access to all the people, and this should be without any discrimination. Vulnerable population. So this I have mentioned before, vulnerable population also, that is special attention. It should be given to the vulnerable people. Here the vulnerable people are the one who are homeless, who are in the remote areas, and the people from the disadvantaged background. Funding. The next cost cutting issues is the funding. Funding may adequate funding should be there, then proper allocation of the resources will be there. So if all this is made, okay, then we can strengthen the mental health services. So we should have sufficient financial support. Then next comes the strategies, directions, and the recommendation of the action. So whatever the issues we are facing now in the mental health, some of the interventions are there. So for that issues, what we all can do is that the first one is the mental health accountability. Accountability, okay, it should be effective. Plus the governments is there, it also should be effective. The second one is the mental health promotion. So what is that mental health promotion is that this mental health promotion they will be attempting to encourage, plus they will be increasing the protective factors and the healthy behavior that can help prevent the onset of a diagnosable mental disorder, okay, and they can also reduce the risk factors. The next one is the prevention stage towards the mental illness and the suicide. Next is universal access will be there regarding the mental health services. Then trained person in the field of the mental health will also should be available. Participation of the community people should be there. Then research, adequate research in the field of the mental health should be there. So why adequate research is required is that if adequate research is there, then we can save the life, okay? And plus whatever the distress is there, the people with the mental disorder are facing, it can be relieved and their quality of life will be increased. Not only research will be benefiting the individual, but it also will be benefiting the entire society. Okay, that is whatever the level of mental illness is there, it will be reducing, plus the stigma, the discrimination which is attached to the mental health issues, that also will be reduced. So these are some of the intervention we can take up in order to prevent the issues in the mental health. Okay, thank you. Okay, if any you can just ask me.
Yes, ma'am. Students, do you have any queries regarding the topic? स्टूडेंट्स आप में से किसी को कुछ सवाल करने हैं तो आप क्वेश्चन कर सकते
No doubt will be there.
हैं How students don't have any kind of.
Okay, they are all clear. Yeah.
It's happy to see you again, ma'am. Thank you so much.
Okay.
Yeah, we met here just for time with us.
Ramya,
Yes, ma'am.
my voice is audible.
Yes, well, you're audible.
Ma'am, very good afternoon.
Yes, good afternoon, ma'am. This what I'm trying to close this. Okay,
Thank
ma'am.
you so much for accepting our invitation in very short time. And it is a long back to see you. My camera is not working. I don't know what you're saying. But I can see you.
Yes, sir. Okay, ma'am. I'm very thankful to you, ma'am. You have given me an opportunity in this platform, and nice that after a long time, I was also able to see you mingle with you, ma'am.
Thank you so much. By seeing I become so boosted up by this, Sumita madam is in front of me. I don't know when we will meet firstly, but virtually today I am able to see you after 3 years. So it's a great time hearing your voice and seeing your presentation. It was awesome. And I know that students are fully satisfied with the lecture. That's why they don't have much question with you.
Either they are fully understood or they are not knowing the topic only.
No, they are knowing they are all senior students sitting over there. So they're knowing they are third year students. They must know the policies. See, the policies are the important chapter for everyone and important part of any field, whether it is the mental health, either others. So we must know the policies behind the all the subjects. तो ये तो important है and I understood कि it's they understood your topics very well. That's why they are sitting over there. Otherwise, they are planned to ask many questions. And I wish to have you in our future programs. I wish you will be there whenever we needed. And yes, we are here for you also. Thank you so much for joining. I request Soumya for the voter thanks. It is planned over there. Thank you so much, ma'am. Thank you so much.
Okay, ma'am. Thank you, ma'am.
I just convey my vote of thanks to Smita ma'am, as she is my teacher also. I'm really grateful to you, ma'am. In short time of invitation, maybe आपने हमारे साथ join किया है. I'm really grateful to you. Behalf of Samarpan Institute of Nursing and Paramedical Science, I'm conveying my regards to you, Sundar ma'am. Thank you so much, ma'am. In future also, kindly please connect with us, and always we will follow with you, ma'am. Thank you so much, ma'am.
Okay, ma'am. Thanks from my side also, Principal Samarpan Institute of Nursing and Paramedical Science, and thanks to the management, faculty, and all the students, and thanks to you, Soumya.
Thank you, ma'am. See you again, ma'am. Thank you.
Okay, okay, see you.